Finishing off part 1 of the PowerPoint slides, let's talk about muscles in and around the mouth and upper throat. The first group are muscles of mastication, and mastication means chewing. Imagine like biting down really firmly. All of these muscles are controlled by cranial nerve 5. Remember, V is Roman numeral 5, called the trigeminal nerve. And these 4 muscles are the temporalis, masseter, and the medial and lateral pterygode. If you watch someone who's grinding their teeth, you need to tell them to stop. But if you see someone grinding their teeth, sometimes you can even see the muscle working way up here. It's the temporalis, which is coming from the temporal bone, and the masseter. These work together to really bite down real firmly. And it makes sense. You can just see how this masseter wants to elevate the mandible. It wants to pull it up. This muscle here is hard to tell in this view, but it comes all the way down to here, and it also wants to elevate this mandible. The masseter is the most powerful and important muscle of mastication. The other ones are kind of harder to see. The lateral pterygode goes more to the outside, versus the medial pterygode goes more to the inside of the mandible. These really help move the mandible side to side, like imagine lining up that piece of popcorn so you can bite down on it. The next group are muscles that move the tongue. And we saw the word extrinsic earlier. We have muscles outside of the tongue that move the tongue. Most of those are going to have the word glossus in the name. But we also have some muscles within our tongue called intrinsic tongue muscles. Like if you can curl your tongue or do any of those cool like folds or waves or any of that, it's the intrinsic muscle that's curling up your tongue. It's the extrinsic muscle that does things like stick my tongue out or manipulate the food so that it lines up with my teeth. Don't get too lost in these. Again, if it's got glossus, it's going to probably do something to the tongue. The genioglossus pulls the tongue forward. There's that styloid process of the temporal bone, and that'll lead us right down to the styloglossus tongue muscle. The one running under the tongue is hypoglossus, and the hard palate would be up here. So this muscle here is the palatoglossus, from the tongue to the hard palate. Also in this view, we can see, remember that hyoid bone? Unique because it's the only bone that doesn't make a joint or articulate with other bones. But now we're starting to see it's real important because not only does cartilage attach there, but a lot of muscles attach there. The pharynx, we could call that like the part of the tube that's going through the neck, all right? It's commonly called the throat. And it's funnel shape. It's a little more wide here, and as it goes down, it gets more narrow. It not only has voluntary muscle, it has some smooth muscle. All of this is going to help me to swallow so that I don't choke on whatever's in my mouth. And the pharynx is part of this cranial nerve 10. X is 10 in Roman numerals. It has several constrictors, and they constrict in order to help push something down, like if that piece of Dorito is stuck in your throat. First, the superior pharyngeal constrictor will push it down a little bit. Then the middle pharyngeal constrictor will contract and push it down a little bit further. And then the lowest one's the inferior pharyngeal constrictor contracts. So it's almost like a snake moving, how it's a series of contractions to help force that Dorito, or a fancy term is a bolus. Bolus is something we've eaten and mixed with saliva. But all of this is, these constrictors help us swallow. This is anterior. We're seeing this person from the right side. Highest up is the superior pharyngeal constrictor. If I get right in the middle, I'm in the middle pharyngeal constrictor. As I get further down the neck, I'm in the inferior pharyngeal constrictor. And you can just imagine how whatever we eat gets forced down this tube. We saw that hyoid bone, and that hyoid bone helps us to divide muscles into 2 groups. If I'm above there, I'm suprahyoid. And if I'm beneath there, I'm infrahyoid muscle. The digastrous muscle is interesting. It starts gastration, it starts digestion because it helps to open the mouth. If I depress my mandible, I'm moving my jaw toward my toes. So digastric helps me to start digestion. The second one, geniohyoid. Since I'm above the hyoid bone, I'm going to raise it up. The mylohyoid muscle also elevates the hyoid bone. The most powerful one that can elevate it, though, is that stylohyoid, coming off of that styloid process. The muscles beneath or inferior to the hyoid bone include the omohyoid. This guy is really cool. It goes from that hyoid bone all the way out to the scapula. We have a sternohyoid from the hyoid bone to the sternum, and a sternothyroid muscle. The words help us. It's coming from my sternum and going to my thyroid cartilage. The thyrohyoid also goes to that thyroid cartilage, and this is part of the swallowing process, hopefully so that once things leave your mouth and go down the tube, they don't come back up. My hyoid bone, if I'm above there, I'm suprahyoid, like the mylohyoid. Kind of hard to see, but this one will be going up to that styloid process, the stylohyoid, that digastric muscle that's going to open my mouth. Now we can see it has an anterior belly and a posterior belly. If I go underneath the hyoid bone, I can find that omohyoid, the one that goes all the way out to the scapula, and the sternohyoid, coming from the hyoid going down to the sternum. A couple of more muscles before we finish this video out. If we go to the muscles that move the head and neck, a powerful one is the sternocleidomastoid. We mentioned that because it has the bony landmarks of the sternum, that mastoid process of the skull, and cleido is clavicle. We have one on each side, a left and a right sternocleidomastoid. If I pull both of them, that's called a bilateral contraction. And if I pull both of those, it makes me look down, flexing the neck. But if I just contract one of those, if I contract my right sternocleidomastoid, that's called a unilateral contraction. And that makes me bend to the right side, or bend to the same side. It makes me rotate to the opposite side. We'll put this together in the picture in just a second. Another muscle group that's on the front and kind of to the side of the neck are the scalenes. The scalenes scale your neck. There's 3 of those, one toward the front, anterior, one toward the back, posterior, and one between those, the middle scalenes. A neat thing about these scalene muscles is they can elevate the rib, like if you're really gasping for air. So now we're looking at this person's left side here. I can see their left sternocleidomastoid. Here's part going to the sternum, to the clavicle, coming off that mastoid process. Deep to it would be those, or a little more to the side are the scalene muscles. Kind of hard to tell them apart, but this would be the anterior, middle, and posterior scalenes. They go all the way down to the ribs over here. And then we also have some muscles in the back of our neck. The ones with capitis go all the way up to the skull. Trying to help you with a few little mnemonics here. The one with cervices go to the neck vertebrae, those cervical vertebrae. What do you know about a muscle that's called longus? Yeah, it probably goes a long way. These muscles are arranged so we have them both on the left and the right. But in this view, again, we're seeing different layers. On you have a left splenius capitis and a right splenius capitis. It's just been removed over here. Capitis reminds me it's going all the way to the cap or to my skull. Look at these little muscles we didn't talk about, but how the words would help us. Rectus capitis posterior minor. Rectus tells me it's probably going straight up and down. Capitis says it goes straight up and down and attaches to my skull. Posterior says it's in the back of my neck, and minor says it's a small one. So it makes sense that right next to it is a rectus capitis posterior major. The ones that run at an angle, the obliquus capitis, are still attached to the skull. When I was a practicing chiropractor in Las Vegas, a patient brought me in a newborn with congenital torticollis. That sternocleidomastoid muscle was too short. And it could have been from forceful delivery, or it could have just been developmental. We don't know. But the answer was if what we were going to do wasn't going to work, they were going to have to do surgery or maybe do some injections to go in and try to get this muscle to relax. But it was amazing. I did a little bit of work, but most importantly, I taught Mom what to do. I just taught Mom the anatomy of the sternocleidomastoid. And I had her doing, very, very light pressure, really just kind of touching the sternum and the mastoid process. But it was amazing the way this baby, this baby responded so fast. And it was just, I'll never forget how, that patient just, it was, they had so much respect for me, and they referred so many patients to me just because we had such great outcome. And it came because of my knowledge of the sternocleidomastoid. Anytime we can postpone surgery or hopefully avoid surgery altogether, heck yeah. All right, let's keep on going. All of these muscles we're about to talk about are deep, or they're underneath other muscles. Here's my iliac crest, and the one coming off of that is this iliocostalis. Ilio because it's coming from the iliac crest, costalis because it's going out to the ribs. Inside of that is this longissimus. The longissimus runs straight up through here, and the most medial group is the spinalis. So here would be this person's left spinalis. Now again, they would also have them on the other side. Here would be their right spinalis, a little further out would be their right longissimus, and coming off of here would be their right iliocostalis. So that's why on my slide here, I just spelled the whole thing out to remind us that these would be left and right. You know, we would have them on both sides. If I contract all of them, called a bilateral contraction, both sides, that's going to make me lean back, vertebral extension. But if I contract just one side of these, it does lateral flexion. Imagine I take your left ribs and bring it toward your left hip. That makes you bend to the left. This will be an ipsilateral or same side lateral flexion. Even deeper, we have muscles that run at an angle, transversospinalis. And these go from the transverse process or the spinous process of vertebrae. They're really, really deep muscles. They're really, really short. And then at the very bottom, we have the quadratus lumborum, commonly called the QL muscle. Some people get spasms in here so much that they think that it's a kidney stone or something like that. Oftentimes you'll see therapy and stretches for QL, and this is what we're talking about, the quadratus lumborum. Check out the way it comes from the iliac bone and actually goes to all of the vertebrae here. And so it can, when this muscle gets tight, it can make somebody lean to a side. I put the chapter summary of what we've covered so far in our notes. I'll see you in the next set of videos. Hey, this is Doc here. I got your back.